So, I'm good at a few things. I can play golf to a 9 handicap, and I can hold my own on a pool table. But one of the things I'm not very good at is dancing. And I really have 2 left feet. But when a fancy formal event shows up on the calendar, I have to rise to the occasion, don my plastic rented tuxedo shoes, try to keep up with my wife, who'll be dressed to the nines in her fanciest dress, her sleekest outfit, and of course, her fanciest heels, which will be her stiletto heels. But no matter how beautiful she looks in those heels, I'm going to pay dearly as that small surface area heel magnifies the force of impact, stabs my feet like weapons every time my 2 left feet get in her way. If only she would wear a blocky heel, a chunky heel, a flat heel. Maybe then it wouldn't hurt so much. But that's not the case for these kinds of parties, and so it's a good thing there's an open bar and lots of alcohol to help me with the dancing. In physics, the fact that a small surface area object can magnify the force of impact is known as the stiletto heel effect. And you may be wondering, why am I telling you about the stiletto heel effect? Well, because it can show up in your dental practice, and it shows up in this very common way. So you have an asymptomatic patient, they're changing 3 old amalgams into new beautiful composites, or they're getting a quadrant of crowns, and instead of them coming back to tell us how much they love their new dentistry, they come back and they're complaining about their bite being off, and they can't chew like they used to, and their teeth hurt. And so we make some corrective adjustments, and we hope that resolves their problem. But lo and behold, in a few weeks or a few days, they're back in the schedule, and they're complaining now, instead of just their teeth hurting, they have facial pain, or they're starting to get headaches. And what's happening here is the small, sharp, pointy, small surface area, cuss tips and marginal ridges and triangular ridges that we create in our new restorations are stabbing the opposing teeth in pain. And this makes it very difficult for the patient to adapt to their new occlusion. And this is known as the stiletto heel effect of occlusion. So what's interesting about that is traditional occlusal indicators are too out of date and too inaccurate to be able to isolate for us these really, truly high-force contacts. And so just like I can stumble around on the dance floor trying to avoid my wife's stiletto heels, so can a dentist stumble through making an occlusal diagnosis with articulating paper. So that's why I'm so excited to be here to tell you about the T-scan technology. The T-scan technology is digital occlusion. It's where a patient occludes on an electronic high-tech sensor, and the sensor relays pressure mapping, occlusal force, and timing information to a computer screen, which graphically displays it in a color-coded format. I've published many articles about the T-scan through the years, and I'm a consultant for the TechScan Corporation that makes the T-scan, but I don't receive compensation for sales. My focus has always been to try to change dentistry's mindset about measuring the occlusion and to illustrate to dentists the benefits that their patients could receive if they got involved with the technology. So let me share with you now 3 compelling studies, the results of 3 compelling studies which show you how difficult it is to use traditional occlusal indicators. First study, 14% of the time. 14% of the time, the paper marks, the articulating paper marks, can show you the force by size. That means 14% of the time a big mark is forceful, and 14% of the time a little mark is light force. But the other 86% of the time, size doesn't matter. Second study, 12.5% of the time. 12.5% of the time, dentists can choose the correct high-force context when they're looking at groupings of paper marks on teeth, which means 87.5% of the time, we choose incorrectly, and that's not very good for the patient. Third study, 95% of the time. 95% of the time, the T-scan technology can show you the high-force contacts. It can measure 256 levels of force and reproduce that time and time again, which makes it very easy to isolate these truly problematic high-force stiletto heel contacts. So if you can grasp the enormity of how incorrect using articulating paper could be, and instead implement the T-scan into your practice, these are the benefits that you'll experience. 1, you'll increase revenues and decrease stress because you won't have as many of these follow-up post-insertion adjustment visits. You'll be able to greatly reduce your implant fracture and breakage rate. You'll be able to instantaneously diagnose chairside cold-sensitive teeth, sore teeth, hypersensitive teeth. You'll also be able to case finish your orthodontic work dramatically better than you can by just relying on settling, and you'll be able to treat TMD problems, muscular TMD, in 30 to 60 days without night guards, deprogrammers, orthotics, Botox, deprogrammers. So if you want to change your patient's, restorative patient's tears of frustration and tears of chronic pain into tears of joy and tears of relief, I highly recommend you get involved with the T-scan technology. It's the one piece of technology that will bring more joy and more relief than any other that you may be considering. Thank you very much.